Our group selected OCD or obsessive compulsive disorder as our psychiatric disorder.
OCD is defined as a psychiatric disorder characterized by obsessive thoughts and compulsive behavior, such as continual washing of the hands prompted by feelings of uncleanliness. It causes repeated unwanted thoughts that may cause patients to do some task over and over again to get rid of these thoughts. These may include checking things repeatedly, hand washing, counting things, checking to see if the door is locked, etc. This disease is common, chronic, and long-lasting. The uncontrollable thoughts are the obsessions, and the behaviors are the compulsions that are repeated. For some patients, they need to order things in a precise way. Some may even have motor tics, which include sudden, brief, repetitive movements, such as eye blinking and other movements, facial grimacing, shoulder shrugging, and head or shoulder jerking. Common vocal tics include repetitive throat clearing, sniffing, or grunting sounds.
Despite the wealth of research, the exact cause of OCD has not been identified, but there are some theories of OCD that could be triggered by a combination of genetics, neurological, behavior, cognitive, and environmental factors. Genetic causes study have shown that OCD runs in families and can be considered a family disorder. The disease may span generations, with close relatives of people with OCD significantly more likely to develop OCD themselves. Behavioral causes. The behavioral theory suggests that people with OCD associate certain objects or situations with fear and learn to avoid those things or learn to perform rituals in order to help reduce their fear. Cognitive theory focuses on how people with OCD misinterpret their thoughts. Neurological causes. Brain imaging techniques have allowed researchers to study the activity of specific areas of the brain, leading to the discovery that some parts of the brain are different in OCD sufferers compared with non-sufferers. Environmental causes. Environmental stress may be triggered for OCD in people with a tendency toward developing conditions. Psychological symptoms, physical symptoms.
Keep going.
Physical symptoms will vary depending on the patient. If they are obsessed with washing hands, they may have a red and dry skin. If they are obsessed with being skinny, they may develop anorexia. If they are afraid of letting go of objects, they may become hoarders. Emotional symptoms may include patients being anxious and constantly on the edge. They may have depression, tension, or excessive worrying. The patient may feel trapped in their head and that someone is controlling their unwanted thoughts. They may also have high anxiety and paranoia. For obsession symptoms, obsessive is accompanied with severe anxiety or fear. The 6 main themes of obsession are loss of control, cause of harm to others, being and becoming contaminated, religion or related themes, urge for perfection, and undesired sexual thinking. Compulsive symptoms include washing and cleaning, repeating, checking, and mental compulsion.
There are no cures for obsessive compulsive disorder, but there are methods of treatments that provide relief from the symptoms to the extent that most patients can live normal lives. Treatment-resistant OCD does not seem to respond to therapies. However, all OCD cases were once considered resistant to treatment. After further study, it is now possible to treat 40 to 60% of OCD patients using medication alone, and new information emerges as treatments progress. Therapies for obsessive compulsion disorder typically consist of medication, psychotherapy, or both. OCD responds well to cognitive behavioral therapy. This type of therapy, coupled with prescribed medication, usually antidepressants or anti-anxiety medications, alleviates the symptoms for most people who suffer from OCD. Cognitive behavioral therapy treatment for OCD may take place in individual, group, or family sessions. OCD patients can experience some relief through cognitive behavioral therapy, particularly a form called exposure and response prevention. This entails gradually This entails gradually exposing the patient to the feared obsession. For instance, if the patient is obsessed with cleanliness, they are exposed to dirt for gradual increasing amounts of time. This helps the patient to learn new thoughts, patterns, and behaviors about their obsession with dirt. Also, this form of therapy takes a lot of time and effort in practice. The reward is a much better quality of life for the patient. The most effective medications prescribed for obsession-compulsive disorder are antidepressants. These medications include Zoloft, Paxil, Luvox, Prozac, and Celexa.